Hello, I am Dr. Dilip Gude, physician, Somajigoda Yeshoda Hospital. Let us discuss about vitamin B12 in specific. So B12 is something which is usually found in non-vegetarian diet usually, and in fact people who are vegetarian who have not consumed meat of any kind or not even egg or milk, they tend to have B12 deficiency. So what really happens when a body is deprived of B12 for a long period of time? Let us discuss those things. So when B12 is less, usually there are two main manifestations. One of it is less hemoglobin, that is anemia, in which the cells are a little bigger in size. So we call it macrocytic or in fact megaloblastic anemia. So this is typical of B12 deficiency or in fact folate deficiency for a long period of time. So when people have this kind of anemia, of course we know what happens in anemia. There's a lot of load on the heart. Heart has to work probably 2 times, 3 times, depending on how much the hemoglobin level is. So you will have to supplement B12 if patients are vegetarian for a long period of time. We have to give B12 supplements, and in some cases, if B12 levels are very low, you probably will need to give injections. So injectable B12 supplementation might be required if especially B12 levels are say 200 or less, and in that case once a week injections, intramuscular injections, you can give 1000 or 1500 micrograms for at least 6 weeks or so, and then couple it with oral supplements of B12. So apart from low hemoglobin, what else can happen when someone has B12 deficiency for a long period of time? One very important aspect is subacute combined degeneration of the spinal cord. So this is something that happens in the dorsal columns of spinal cord, the cord that comes down from the brain. That's an extension of the brain into the vertebra or spine. So that is something which happens over a long period of time, and then these neurons in the dorsal columns of spinal cord, they get affected, and people have various symptoms like numbness, and then over a period of time they can even have wasting and various neurological problems, some of which are irreversible or irreparable. So we need to understand that B12 deficiency for a long period of time can, importantly, it can cause severe anemia and then severe neurological problems also. So B12 deficiency needs to be identified. There needs to be a high clinical index of suspicion, and you need to supplement it. And based on the degree of the deficiency, you probably might even require IM, intramuscular, or even sometimes rarely IV as well. So once you give intramuscular, you can give oral supplementation and make sure most of it, the anemia part can be reversed, but the neurological deficit, if it has already occurred, only some part of it can be actually reversed. So discuss with your doctor, especially if you have symptoms of these sort, and if your RBC levels are seemingly larger, and if there is a macrocytic or increased RBC, that is MCV, mean corpuscular volume, then there is a high chance you may be suffering from B12 deficiency, and you might require supplementation as deemed necessary by your physician. Thank you.